Broadcast is now starting. All attendees are in listen-only mode.
Hi, everyone. Welcome to today's webinar, Fight CRC webinar. My name is Sharon Worrell, and I'm with the education team here at Fight CRC. So our webinar today is Clearing the Air, the Role of Medical Marijuana in Cancer Patients. Our speaker today is Dr. Hull. We're excited to have her join us today. A couple of logistics for the webinar. We will be having a moderated Q&A at the end of the session. You can ask a question in the panel on the right-hand side of your control panel on your screen. And after the webinar, you'll be able to watch a recording. It will live on the Fight CRC website. You can visit fightcrc.org/webinar to access the recording in addition to slides. And also, if you are on Twitter, please join the conversation using #CRCwebinar. Fight Colorectal Cancer has a number of patient-friendly resources, including but not limited to our Tabooty podcast series, our mini magazines, which are topic-specific, and our clinical trial finder, the late-stage MSS CRC trial finder. The information and services provided by Fight CRC are for general informational purposes only. The information and services are not intended to be substitutes for professional medical advice, diagnoses, or treatment. If you are ill or suspect you are ill, see a doctor, and in an emergency, call 911 or go to the nearest emergency room. Fight CRC never recommends or endorses any specific physicians, products, or treatments for any condition. And with that, Dr. Hull is an associate clinical professor of pharmacy in the Department of Pharmacy Practice at the UConn School of Medicine. Her current research interests include those which evaluate the impact of oncology pharmacy practice services on patient care, adherence to and patient education, understanding of appropriate use of orally administered oncology medications. Ongoing and future projects focus on the patient-related outcomes of oncology pharmacy practice care within a team-based approach and pharmacist-led education and cancer risk assessment and screening in the community pharmacy setting. We're very excited to have Dr. Hull here today to talk to us about medical marijuana and the role it plays or could play in cancer. So we'll go ahead and hand over the control.
All right, thank you, Sharon. And thanks to the organization for inviting me to participate in this webinar today. So I think it's always important to start out a talk about medical marijuana by conveying some of the information that is used in terms of interchangeable words when we talk about medical marijuana. So one of the words that is often used when talking about medical marijuana is the word cannabis. And cannabis really is a word that defines anything that is produced from the plant itself. And the plant is a cannabis plant, which has several different species, including sativa, indica, and ruderalis. In the United States, we most commonly have the sativa and indica strains because ruderalis is not a high yield producing plant. And then other words that are often used are marijuana, which really is, if used correctly, is referring to the flowers or the leaves of the cannabis plant. Some people also use the word hashish, and that is blocks of resin. So all plants have a resinous material associated with it, and that is what hashish is derived from. Cannabinoids is another word that you'll see when looking at information regarding medical marijuana, or you might hear that word when people are talking about medical marijuana. And a cannabinoid is any product that exhibits a drug-like effect. In humans, we have our own system, so that's called endogenous. We have a cannabinoid system within our body that produces many biologic effects, and it mimics the effects that are often seen from a cannabis plant. Phytocannabinoids are cannabinoids that are produced by this cannabis plant, so it would be something like marijuana, or we also have synthetic cannabinoids that are derived from chemicals and are available as a drug, at least within the United States. We have a couple of those products on the market. So we have our own system in our body that mimics the effects of medical marijuana, or of marijuana itself. We have phytocannabinoids, or the plants that produce marijuana products. and then synthetic cannabinoids, which are drugs which are available by the Food and Drug Administration. So when people talk about medical marijuana, they may talk about all of these things. Specifically, when we're talking about what we know about its effects in cancer, most of the research that has been done has involved both synthetic cannabinoids and also phytocannabinoids. Now, medical marijuana is not necessarily new. It's actually pretty new, I guess, if you consider Western medicine compared to other types of medicine. It was first introduced in 1840 by a surgeon by the name of William B. O'Shaughnessy. He traveled to India and he learned about the medicinal properties of marijuana, how it can be used to treat pain, for seizures, for anti-spasms, or helping with spasms or muscle spasms, inflammatory processes. And so he thought that this would be very useful in Western medicine and brought it back to the United States. It was used very widely throughout the 1800s and the early 1900s. But at some point, the US government decided, specifically the Treasury Department, that they could actually make some money off of the use of marijuana. It was available widely, so it could be used for medicinal purposes, and people also used it recreationally at the time. And so they levied a tax, both for recreational and for medicinal marijuana, a much higher tax for recreational than medicinal marijuana. At that time, in 1937, the American Medical Association, which is an association of physicians, was actually very against this tax because they thought it might limit the availability of this very active drug. And then over time, there, as with any drug that has some potential for abuse, sometimes it can be used in a negative way. And that negative presence of marijuana when used recreational sort of gained traction among people. And that's when it became labeled as a narcotic in 1951 through the enactment of a Boggs Act. But it wasn't until 1970 before it became illegal in the United States. In 1970, there was an act passed through the national legislation called the Controlled Substance Act, and that made marijuana a Schedule I drug. What that means is that a Schedule I drug is defined as a drug that has no medicinal purpose, so no effect that would be helpful to humans, and has a high possibility of addiction and therefore potential diversion. There were people, though, who were benefiting from marijuana at the time, and I think a group of patients who probably, for those of you who were living during that time, would know that the HIV/AIDS epidemic resulted in many patients having anorexia and weight loss, as well as chronic nausea and vomiting, and marijuana was very effective in those patients. And so some of those patients were able to receive the drug on a compassionate use basis, even though it was considered illegal. In 1986, because we knew that there could be some benefit of marijuana in diseases like HIV-associated weight loss and chemotherapy-induced nausea and vomiting, synthetic drugs like dronabinol or Marinol were introduced by the FDA and approved for use in certain patients. And then it became more medically used through the synthetic formulations and available recreational, although illegal at the time, until 1996, when the first state, California, passed a medicinal marijuana legislation that allowed certain patients with conditions that might benefit from marijuana to receive it legally within their state. And then many states would, and I'll talk a little bit more about which states have a legalization of marijuana currently in the next slide. In 2018, another historic landmark happened. The Food and Drug Administration of the United States passed a drug called CBD, or cannabidiol, that was produced from the cannabis plant to be used and not considered a controlled substance one any longer for patients with epilepsy who had very severe epileptic syndromes and were unable to tolerate standard medications. So that's only available for a small group of patients currently. And this map here shows you that all the states that are both in the lighter green and the darker green have medical marijuana approved. So 33 states and the District of Columbia currently have legalized medical marijuana within their state. The states that are darker green also have legalized recreation marijuana, and that includes District of Columbia as well. You might wonder, as many people do, why states that have recreational marijuana laws enacted still have medical marijuana, and they tend to both have dispensaries for recreational use and for medicinal use. In most cases, the medicinal marijuana dispensaries are offering products that are at a lower cost, so they're not taxed as much, similar to what happened early on in the United States with the tax levy legislation. And also they tend to have a wider variety of products with higher potencies available, so that patients who may benefit from medical marijuana are able to get it in many different forms. There are many differences in each of the states who have medical marijuana programs, so the laws vary quite a bit. And I would encourage you, at the bottom of this slide here is a nice resource by ProCon.org, and they have summaries of each of the laws for both medicinal and recreational marijuana programs, and also links to those state regulations where you can find out more about the information for each state's program. What things are common among each of the states is that to be able to obtain medical marijuana, you have to have an approved condition, and you have to be certified to be able to obtain medical marijuana. What that certification process is differs between state to state. Some states will allow patients who have a medical marijuana certification to cultivate or to grow their own marijuana, but not all states do. For example, in the state where I work, in Connecticut, you only can get medical marijuana from a dispensary that is approved. You cannot grow it on your own. There are some states don't allow dispensaries, and those are listed for you there, but most of them do have dispensaries. What's unique about some of these programs, and Connecticut is one of these states, is that pharmacists have oversight at the dispensaries. So a healthcare professional who is knowledgeable about how drugs work in the body, including medical marijuana, is at the dispensary being able to provide guidance to patients. Other other dispensaries, don't necessarily have anybody that's involved in the healthcare industry as a part of the dispensary. So that may just be an entrepreneur or somebody who has experience otherwise with recreational marijuana growing or dispensing, etc. And then the other thing that is important to understand is even if you are approved or certified to use medical marijuana in a state that has a medical marijuana law, it doesn't mean that you can go to another state necessarily and get medical marijuana in that state. There are only a few that recognize patients who have certification from other states. And those are states like Arizona, Arkansas, Maine, Michigan, etc., that are listed there for you on the slide. So how does medical marijuana work in the body? One thing to understand is that there are many different components of any plant. This is true of any plant, not just cannabis. What we know is there are three main components of cannabis. There's the phytocannabinoid, the actual substance that sort of mimics the endogenous, or the system that we have in our bodies already. And then there's within that category, as you can see on the left-hand side here, there's something called tetrahydrocannabidiol, or THC. Many of you who may know of marijuana have heard of this as the component that often is associated with the euphoria or the high that you might think of with recreational marijuana. There's also cannabidiol, which is a very active product or ingredient as well. And then there's some other ones such as cannabinol, cannabigerol, etc., where we don't really have a good understanding of how they have effects in the body, but likely do. Terpenoids are the oils that are associated with any plant, and those are also associated with the cannabis plant. There are a variety of those that have been identified. It's thought that these sort of enhance the sensation that a patient has, both with smell and taste, if they have an edible type cannabinoid product. And they probably do have some medicinal properties, although that's not fully understood to date. Flavonoids are also another component of plants, and they're purported in many circles to possibly have some medicinal properties like antioxidant or anti-inflammatory properties. How these may contribute to the effects from cannabis in the human right now is not well understood, but as we learn more about cannabis, it's likely that we will be able to have information about how this affects our biologic system. Currently, we have two main components of the endogenous cannabinoid system. So this is the system in our own bodies that is always working regardless of whether we consume any medical marijuana. Probably the most common chemical that we're aware of is anandamide, and that is known in Sanskrit to mean internal bliss. The cannabinoid system works on the neurons within the system, so those are the cells that comprise of the nervous system and modulate different effects within the body, including our pain receptors, whether there's inflammation, making sure that we don't have seizures or convulsions, etc. Synthetic cannabinoids, as I mentioned, are drugs that are made from chemicals that mimic the same effect of either plant-derived cannabinoids or our endogenous cannabinoid system. Currently in the US, we have 2 synthetic cannabinoids, nabilone and dronabinol. And then there are non-classical ones, which are surfacing in the lay public, things like K2, which you might have heard of, being responsible for some overdoses. So those are also synthetically derived or derived from a lab. So as I mentioned, the THC and the cannabidiol, which is sometimes known as CBD, are the 2 portions of the cannabinoid that are most well understood, and we have the best understanding in terms of what effects they have in the body. THC, as you can see by this red circle here, is responsible for analgesics, so for helping with pain, for reducing inflammation or spasms. It can help stimulate the appetite. It can work to dilate the bronchioles or the airways within the lungs. It can protect the nervous system and works as an anti-nausea and vomiting or antiemetic. CBD also has some of the similar properties, but in addition to that, it helps with anxiety. It can help with depression, psychosis or psychiatric illnesses, and immunosuppression as well. The products that are on the market for medical marijuana may be fully THC alone, fully CBD alone, or could it be a hybrid of these projects in a variety of different formulations? So it might have more THC than cannabidiol or vice versa. Now this is I realize it's a little bit of a complicated slide, but I think I'd like to just show you how it has a biologic effect. So these are the anandamide and the 2-AG are the normal chemical structures that work in our body to produce the effects that are similar to what someone might experience if they ingested a plant-based cannabinoid or marijuana. It works on these neurons by changing and binding to different portions of the cell or part of the neuron. So we have in our body things like calcium and potassium that help regulate how our cells in our body are acting. And the cannabinoids will bind to these channels on the neurons, and that allows release of certain neurotransmitters, things like dopamine or gabapentin, that help modulate the nervous system. And by releasing those, they then are allowed to bind on neurons and create the effects that we might have for managing pain or inflammation, etc. So we know that most of the receptors where the cannabinoids bind to create the biologic effect are located on neurons. But we also know there are some receptors on the immune system, and we don't really understand how well this works and in what context specifically. And so we're still learning a lot about how marijuana works in the body. So medical marijuana is available from dispensaries in a variety of forms. People who know of marijuana from a recreational sense probably are most familiar with smoking or rolling it into a cigarette type form. That's done with a flower version. It's in the medicinal world, it's recommended not to smoke the flower because when you cause the combustion from smoking a cigarette or the flower, it can produce some carcinogenic substances. So typically, if we're looking for an inhalation format, it's now recommended to use a vaping mechanism, so having an oil that is combustible through a vape pen or through a vaporizer, which is shown here. Most people are using a pen dosage form at this point. You also can take it as a pill, as an oil or a tincture that you put under your tongue, as edibles such as crackers or cookies or brownies. Pretty much any sort of baked thing could have the flower baked within it. Rectally would be using a suppository. Sublingually means putting it under or in your mucosal membrane of your mouth, so on the cheek or underneath your tongue. Transdermal means putting it onto your skin, so there are lotions or patches that can be developed. Ophthalmically are eye drops for patients who have glaucoma. And then, although not available in dispensaries in the United States, there are people evaluating whether you could give this into your central nervous system. That's called the intrathecal route. That might be helpful for patients who have brain tumors, for example, or leukemias, and also intravenously through your veins to give systemic absorption. These are really considered to be investigational formulations, but are potentially feasible in the future. So a lot of people are wondering about CBD oil. This is something that is advertised and actually can be sold in all states based on the enactment of the 2014 Farm Act, which basically classified industrial hemp, which is a sister plant to cannabis, and it allows that to be available under law if it contains less than 0.3% of THC. And cannabidiol in and of itself, by itself, typically doesn't have THC in it. So it can be purchased through internet sources. Sometimes it's sold in convenience stores or smoke shops or things like of that nature. There are many purported benefits of CBD oil or cannabidiol oil. I think what's important to understand about this product, as opposed to products that are purchased from a dispensary that in a state where it's legalized, is that this is a dietary supplement. And in the United States, dietary supplements are not regulated at all by the Food and Drug Administration. There have been instances of other dietary substances, not necessarily CBD, but other supplements that have had ingredients other than what is labeled on the container. It is not necessarily under a quality control environment, so it's possible that these could be contaminated with other, laced with other ingredients that could be detrimental to somebody's health. So I wanted to make that point just to make people aware that we just don't have the regulation. It's very possible that what's being sold is what is advertised and is not contaminated in any way, but it is important to understand that we don't have a regulatory pathway right now for this oil. The products that I mentioned previously that are approved by the FDA are dronabinol, also known as Marinol, and nabilone, also known as Sesame. These are synthetic versions of the active ingredient THC, and they've been approved for CINV, which means chemotherapy-induced nausea and vomiting, so patients who have cancer receiving chemotherapy who have not tolerated other anti-nausea medications. What's important to know, though, is that these medications were approved by the FDA long before we had the very effective anti-nausea and vomiting treatments that we use for cancer patients these days. With the regimens that we have available to us now, we can prevent nausea and vomiting associated with chemotherapy in greater than 90% of patients using our standard anti-nausea medications. So these products don't have as much of a role anymore with the chemotherapy-induced nausea and vomiting, but can be helpful in patients who have nausea from other conditions related to their cancer. In 2018, as I mentioned, the FDA approved a plant-derived version of CBD solution to be used in pediatric patients or adults with these very specific types of epilepsy syndromes that are typically resistant to anti-seizure medications that are available. To allow this to be available by the FDA, the Drug Enforcement Administration had to allow this to be a Schedule 5 drug, which means that it's a controlled substance, but it has a very non-limited restriction on it so that it can be prescribed and have renewed prescriptions. In Connecticut, we allowed it to still be a higher scheduled drug that has much more regulation associated with it. And other states have also done the same. Nabiximols is also an extract that is combined with THC and CBD, and it's called sativa, but is currently not approved in the United States. The reason I'm discussing it today is that when I show you some of the evidence that we have, there are many studies that have evaluated this particular product, and it is available in many other countries worldwide. So one important aspect of medical marijuana is because we have different ways to administer it, meaning we can take it through our mouth, we can inhale it, we can put it on our skin or have a rectal administration. The way that we absorb it depends on the way that you administer or consume it within your body. And that's really important to understand as a patient, because if you're using different dosage forms, you might expect to have the same effect when in reality it can be very different. So for example, if you're using a vaporized formulation, it's very quick in terms of how quickly the body absorbs it and how quickly it's delivered to the brain, where many of those effects happen. The peak level in the body where you're going to have the most effect is going to happen pretty quickly within about 22 minutes. But it can depend on a variety of things, like how long you're holding your breath after you inhale, how deep you inhale into your lungs, and how many puffs you might be taking off of the pen, the vape pen. As opposed to edible formulations, such as if you were to have a gummy or a cracker, for example, the absorption in the body, because it has to go through the stomach and the intestines, is very slow. And the time to getting the peak level on average is about 1 to 2 hours, but can be up to 8 hours. This is really important because if you've only smoked or used a vape pen before and then decide to buy an edible formulation or an oral formulation, you may expect that you're going to get the same effect, when in reality it could take much, much longer. And you might eat more or consume more thinking that it's just not strong enough, and you might need to, that might help. And when in reality, that could actually make it so that you have more side effects. So these things are important. Taking it under the tongue or in the cheek or using it rectally are also pretty quick. And transcutaneous or transdermal, putting it on the skin, is similar to swallowing, but can take up to 48 hours as well. And these are just, when I'm talking about first pass metabolism, what that means is how quickly it is metabolized by the liver. If it's high, then that means it gets quickly digested by the liver so that it's not lasting in the body for a long period of time once it hits that peak. So that is exactly how your body digests. The majority of marijuana is through the liver, but there is some metabolism, how it's broken down into inactive ingredients in the intestines, lung, and brain, and it all depends on how you consume that marijuana as well. Because of the fact that it's metabolized or broken down in the liver, there can be interactions with other drugs that you might be taking. So any drugs that also cause dizziness or drowsiness could be compounded, meaning you could have more dizziness or more drowsiness if you're taking it with marijuana, especially that has a high THC content, which tends to make you feel a little bit sleepy or drowsy. There are also many other interactions because many drugs are metabolized through the liver. So what I recommend to patients is to let your healthcare provider know whether you're taking medical marijuana or not. They can then review your medication list, and a pharmacist can do the same to be able to identify if there are any important drug interactions that you should be aware of and what you might be able to do to try to minimize any side effects from that combination. So what about the evidence? Meaning, how likely is it to be effective in patients with cancer? So I work with cancer patients on a daily basis. We in Connecticut have medical marijuana available. We do not have recreational marijuana available at this time. And we have many patients who have benefited from receiving medical marijuana for a variety of different symptoms. And I think patients, when they are diagnosed with a cancer, they're always looking for a cure and a hope to be able to get their cancer under control. And that, of course, is what we are trying to do in a cancer center as well. There are many reports when you search medical marijuana and the treatment of cancer on the internet, but in reality, we have very little evidence about the effectiveness of medical marijuana for the treatment of cancer. It's being explored as a possible cancer treatment, and certainly it would be excellent if we would be able to demonstrate that this widely was effective in the treatment of any cancer. But right now, it's mostly in an evaluation phase and what's called preclinical, so looking at laboratory-based models of cancer or animal-based models of cancer. There was an early phase clinical trial looking at patients with a type of brain tumor called glioblastoma that was refractory to standard treatments, and found that by giving medical marijuana directly onto the tumor in the head, that was able to benefit a couple of patients out of the 9 that were treated. There's also been 1 or 2 case reports of looking at patients with brain tumors or types of leukemia where they were consuming cannabis products and they found to have some responses associated with them. So there's some possible link. Of course, we don't know if it was specifically related to the marijuana. And in progress, we have several different trials that are ongoing, looking at the potential of these products to be useful in patients with solid tumors and brain cancers. There was one study that was recently reported in an interim results, meaning just a small amount of the data was reported at a recent meeting, and a whole full publication about the results is in progress but hasn't been fully reported yet. It looked at patients who were receiving immunotherapy, drugs like Keytruda, nivolumab, pembrolizumab, Opdivo is another brand name for nivolumab, and Keytruda for pembrolizumab. Those are some of the immunotherapy drugs that are on the market, and there are many, many more. This was looking at patients receiving drugs like that and also using cannabis. And they found that patients who were using cannabis and these immunotherapy drugs had a lower response rate than those who were not, but the overall disease outcomes like survival and time to progression were not changed. So this gives me a pause a little bit about whether or not we should be having patients use cannabis while on immunotherapy, but because this is limited data from one institution and it hasn't been validated, we don't know for sure if that's the cause. So I'm not sure at this point in time that I would recommend against this, but you should just be aware that there could be some possible chance that it could alter the way immunotherapy works. Oh, I'm sorry, I had this on the next slide in more detail here. The patients that were in this trial included those with melanoma, non-small lung cancer, and kidney cancer. But what about cancer symptoms? As I mentioned, this is really where we seem to have the best effect. There are over 30 studies that have been published looking at nausea and vomiting associated with cancer therapy, looking at a variety of different products, including synthetic and plant-based marijuana. There's also a large study called a meta-analysis looking at all of these studies together and showed that it was significantly more effective, any types of these marijuana products, to be helpful for nausea and vomiting. But what I said previously is that we don't have studies that are actually comparing it to our current antiemetic regimens. So typically we reserve this marijuana for patients who are not responding well to our current regimens or may have nausea from the cancer or from other types of treatment. It also has been evaluated in patients with cancer-associated pain. Again, these are all sorts of different types of what we would call well-designed trials with a variety of numbers of patients, anywhere from 10 to 360, and looking at also, again, mostly synthetic products on this particular page. They found that there were some improvements in mean pain. Some of the data shows that it wasn't significantly different than maybe using a placebo or opioid, but it's possible that it's related to the type of cancer pain that patients are having, or that perhaps maybe these doses weren't the right doses to be effective for pain treatment. Because we do see some anecdotal evidence in our own patients that they have improvements in pain, and it seems to be improving pain that is associated with neuropathic origins, so pain that's associated with nerves. It's also been evaluated for patients with anorexia or weight gain, and this was a well-designed trial that was published many years ago now, in 2002, that looked at the synthetic product dronabinol compared with another drug called magestrol, which is not marijuana-based. It's more of a steroid kind of based type drug, and then a combination together. And all of them showed an increase in appetite, but it was actually much better with this other drug or the combination than with dronabinol alone, even though, again, we see effects in particular patients who don't tolerate other therapies. There was another study that was done in cancer patients that looked at using the plant-derived extract that combined THC and cannabidiol versus THC alone or placebo. What it found is that cannabis extract was better than THC alone, and it was slightly better than placebo, but it wasn't a great big difference. It was 73% versus 69%. And there was no difference in in anorexia, that's a typo there, quality of life, or toxicity. So again, not showing as wide differences and changes of effect, but just a small difference. And again, this could be related to the fact that maybe this isn't the right dose or the right combination of therapy of ingredients to have the best effect. We also have patients, I have a patient actually currently who says that his medical marijuana has really significantly improved his sleep. He was only able to sleep about 2 hours a night for the last year and a half. And once he started using medical marijuana, was able to have up to 5 hours of sleep a night. So greatly improving his quality of life. And indeed, there have been several studies that have been well-designed, placebo-controlled studies, looking at, again, at a variety of different plant-based and synthetic-based products, and found a greater average improvement in both sleep quality and a reduction in sleep disturbances. So it does show some effect, again, for this indication. And although no studies have been done specifically in cancer patients who suffer from depression or anxiety, there have been other studies that have looked at this in non-cancer patients. No well-designed trials really evaluated depression alone, but depression was a secondary outcome or another outcome in studies, and it found that there didn't seem to be a difference. But there was a positive benefit seen in patients who had anxiety who were also being treated with chronic pain. Actually, before I go on to the side effects, What I wanted to summarize here is that what we have is very limited evidence to show the effectiveness in cancer patients for treating cancer itself or for the symptoms associated commonly with cancer treatment or the disease itself. Part of the reason for that is because of the fact that marijuana has not been legal in all of the states for many years by the federal government, and it is only available in some states, the amount of research that we have, it has been limited by that fact. Most of what we know about medical marijuana is based on anecdotal evidence from our patients who have been using medical marijuana, from folks who work in medical marijuana dispensaries, and some information that is available from other countries who have had approval of marijuana for some time, although it's hard to find that printed in the literature. So it's very different from any drugs that we have on the market in that respect. Nonetheless, I think there is benefit, and I would say from a healthcare provider who cares with patients using medical marijuana, we do see benefits in patients, but it's important that we continue to document that so we have better information for all of you. Some of the side effects or adverse effects that are associated with cannabis medications, whether they're synthetic or from plants, include things like dry mouth, drowsiness, dizziness. Some people may feel anxious, especially if they're having the THC component of cannabis. And you can feel a little bit fuzzy or have some cognitive effects with those products. If you're using a smoked variety, then there tends to be cough or phlegm production as well as bronchitis that can be more common. But if you're using non-smoked or non-vaped inhaled formulations, then it's not as common. You may experience some blurriness, headache, or a sense of euphoria. Again, those tend to be more common with the THC-based products. And then rarely you can have something called orthostatic hypotension. That's where if you sit up or stand up quickly, your blood pressure may drop and you may feel dizzy. Anybody who has a personal history or a strong family history, meaning many members in your family who have paranoid schizophrenia or psychosis, that's a possibility that it could happen, although very rare. And the other situation where that might happen is if you consume a large amount and have a toxic level in your body, patients can sometimes feel a sense of psychosis. Some people tend to have depression, but as I said, other people use it for depression. I have not seen that happen in most patients. You can have some discoordination, or another word for that is ataxia, so the inability to walk in a straight line. Usually that is temporary. Patients who have heart disease that is not well controlled can be at risk for having an increase in blood pressure or heart rate. Tachycardia is the word for high heart rate. And if you consume it slowly and let your body get used to it, you tend not to have that. And some patients experience diarrhea. There's also a phenomenon that's been reported more commonly, and mostly in states with recreational marijuana, where people are consuming it commonly or in chronic conditions, might experience hyperemesis. So that means a lot of episodes of having vomiting, and it's usually due to patients who are chronically using a high amount of marijuana. One study has been done looking at sort of long-term side effects of using marijuana in chronic non-cancer patients for a full year. They found that the incidence of non-serious side effects or adverse events was similar between that and placebo, that there were expected nervous system side effects because it's modulating the nervous system or the central nervous system, and that serious side effects were not different. There were no changes in lung function test or neurocognition, no changes in other organ functions, but there did find that these patients did have a decrease in pain intensity and their quality of life was improved, indicating that overall it's probably well tolerated compared with most other drugs that you might use for pain. As I mentioned, this hyperemesis syndrome is associated with paroxysmal, which means recurrent and not necessarily predictive episodes of nausea and vomiting. If this were to happen, it can be mitigated or stopped by a hot bath or shower. But if it isn't stopped, it can go on to develop all sorts of significant complications such as kidney failure, depleting electrolytes, which can affect your heart conduction and how your heart beats, as well as having a pneumonia-like syndrome around your lung area. So most of these patients end up in the emergency room and have to be treated with different medications and then eventually be recommended for a substance abuse program so that they can stop their use of cannabis. I have not seen this in any patient who is using it for medicinal purposes and using it appropriately. I think this is really more in the situation where recreational users are using it and not getting the appropriate guidance on how best to use this type of medication. When we talk about drugs, we always consider contraindications, or when you should not use a drug. The same thing happens for medical marijuana. If there was any sort of allergy associated to that or the product, you would recommend not using it. As I mentioned, in somebody who has a history of psychotic disorders such as schizophrenia, they should not use marijuana because it might tip them over into a psychotic episode. And if you don't have well-controlled heart disease or cardiovascular disease, that needs to be well-controlled before using medical marijuana. Also, women who are pregnant or nursing should not use it because it can pass to the placenta and through the breast milk. There is some potential for dependence for abuse, but just like with opioids, if you have a reason to be using medical marijuana and it's helping that condition, people don't usually become dependent on them. In terms of driving, it's best not to drive immediately or within a few hours after consuming medical marijuana. If you're using the inhaled form, waiting a couple of hours is appropriate. The oral formulation, you might have to wait longer. So now that you have the evidence that we know about the drug, there are some information or things to consider about the legal implications. As I mentioned, there are some states that allow this, but the federal government still considers it to be illegal. We know that there are patient benefits, and so this sort of suggests that we should maybe be able to use this appropriately. But there are some considerations. It's best used when a patient has a qualifying condition and has failed other standard therapies first. Some people recommend that a patient should fail an FDA-approved cannabinoid like dronabinol, but I would argue that's not necessarily true because we know that those synthetic cannabinoids are only containing THC, and sometimes cannabidiol can be a more effective ingredient. And again, we should ensure that they're not at risk for substance abuse or any sort of psychiatric disorder, which might make them more likely to have symptoms of their disorder. The state medical marijuana programs require providers, like a physician, or in some states a nurse practitioner, to certify that a patient has a qualifying condition. And the conditions which qualify for medical marijuana vary from state to state, but in all 33 states, cancer is a qualifying condition. The patient has to register. In some states, they allow a caregiver to pick up products on the patient's behalf, and you usually have to go to a dispensary in those states that have dispensaries to actually get the product. You can't go to a pharmacy and pick it up or get it in the hospital typically. Just as an example, these are qualifying conditions for adults in the state of Connecticut. They range from things such as I mentioned, cancer, to things like Crohn's disease, epilepsy, glaucoma, muscular dystrophy, post-traumatic stress disorder, fibromyalgia, terminal illness, ulcerative colitis, etc. So there's a large variety of symptoms. Even though we are often treating insomnia or anxiety or weight gain in our patients with cancer, because they have a qualifying condition of cancer, that's what we certify them for. We also have qualifying conditions in Connecticut for children, and you can see here these are very severe and debilitating conditions. As an example, and again, all dispensaries differ. In Connecticut, we have pharmacists who work at the dispensaries. It's a similar in terms of restrictions and requirements as a pharmacy. They have very strict security systems. In fact, they have to have 3 locked doors to enter a dispensary, and the only way you can get into a dispensary is if you have a card, either as somebody who works there or a patient or caregiver. In Connecticut, pharmacies can't compound or make products. They actually have to get them already made from a producer. And we have to review the prescription monitoring program to see what other drugs patients may be taking so that we can actually and accurately educate them. In this case, the pharmacist can help with symptoms and the patient to select a product and allow the patient to report how well it's working or how many side effects they might have. In Connecticut, in our dispensaries, there's basically like a menu that's available, and pharmacists can help the patient decide how to pick different products. Another thing to know about, in all states, I think with the exception of Minnesota, most hospitals will not allow medical marijuana use within the hospital. The reason for that is multifactorial. One is that there are, we don't have a great understanding of how medical marijuana works, and our healthcare providers and teams have not really been educated about, medical marijuana as a treatment option. Most hospitals receive federal compliance through licensure as well as funding. And because this is a federally illegal substance, they're at risk for losing that licensure or funding. So most would not be in a place to really consider that. Pharmacists and healthcare providers are not allowed to obtain medical marijuana, only patients who are certified. And so we can't provide medical marijuana in a hospital. And then there's the risk of potential diversion if it's kept within a hospital. Also, most hospitals don't allow smoking or even vaping. And so as a result, typically inpatients at a hospital are not allowed to use medical marijuana, which is troublesome if it's been working very well to treat symptoms outside of the hospital. So how your healthcare provider should monitor your use. It would be the best practice to be able to ensure that they see if there are any changes in your conditions, what your medication list is, how effective it's working, what side effects are happening, monitoring your liver to make sure that it's working well and metabolizing or breaking down your drugs and marijuana. Also, they should make sure that they counsel you and provide you with the information to try to make sure that you're safely using it. So not driving while using the medication, what you can do to try to prevent anybody in your family or friends or caregivers that could possibly steal the marijuana, and then making sure that we're trying to accomplish whatever the goals of treatment you have and are helping you in the best way to achieve that. So I think as a patient, some things that you need to know are what the registration process may be for medical marijuana in your state, that there's variability of quality and concentration of cannabis products, and also the cannabidiol oil that may be available outside of a medical marijuana dispensary. That typically starting with a lower dose and going slowly titrating up to a higher dose is the best way to avoid side effects. There are many different dosage forms, and the way that it affects your body will depend on that dosage form. I talked about the fact that there are some side effects, although overall it's well tolerated, that women who are pregnant or breastfeeding should not use medical marijuana. And there are potential drug interactions, so having a healthcare provider and hopefully a pharmacist would probably be the best person to be able to accurately help you with that. Most medical marijuana, or I should say, insurance companies in general in the United States will not pay for medical marijuana because it's federally illegal. So patients have to pay out of pocket, meaning that it can be very burdensome to patients who do not have money. I know in Connecticut, medical marijuana dispensaries do have some programs for patients who have low incomes. And then traveling outside of the state with marijuana would be considered federally illegal. You're not allowed to leave the state or cross state lines with marijuana. So that becomes troublesome if you're traveling and the medical marijuana is controlling symptoms. Also, I would recommend just making sure that it's kept in a safe place away from pets, small children, and anybody who might be trying to steal it from you, and keeping track of your symptoms so that you know if it's working or things need to be changed. So I'd like to summarize by saying that reminding you that both THC and CBD are primarily responsible for the medical or effects within the body. There's somewhat limited data to support its use in cancer and associated symptoms, yet many patients still have benefits, and I think it's really due to the lack of well-designed studies, and hopefully we'll have more information as more states and more countries are using marijuana. Most of the side effects are transient, meaning that they'll go away after your body becomes used to them, and can be also adjusted by slowly using different doses. And finally, patient certification process can usually be facilitated by the dispensary staff. So if you're having trouble certifying, I would call your dispensary to see if they can help with that. And at this time, I'll be happy to answer questions. I do have a couple of resources here that I think are very helpful for those of you who might want to learn more, especially this resource from Canada. It has a lot of information about the medicinal purposes, although it is geared for medical professionals. So at this time, I'll be happy to answer questions, and I believe you can type those in the chat question box on the right of your screen.
Thank you so much, Dr. Hull. What a great presentation. A lot of information covered there. And yeah, just as she said, if anyone has any questions, feel free to type those in to the control panel, and I can see them here, and we'll ask your questions. So we do have a couple that have come in. The first one is about, let's see, okay, so is there any possible side effect or risk associated if a person is using medical marijuana during a procedure where anesthesia is being administered?
Yes, I suppose there is the potential for a risk because anesthesia is causing your body to become in a highly sedated state. And so I would recommend that if you're undergoing a procedure that you refrain from medical marijuana. definitely on the day of the procedure, but it probably would be helpful to stop 1 or 2 days before, especially if you're a chronic user. That's based on what I know. I've not seen any literature supporting that, but just thinking about the way these medications or drug works.
Thank you. Let's see, we have a couple other questions that have come in. Where should a patient start if they want to find out if medical marijuana is right for them? Would they talk to their doctor, a pharmacist, someone else on their healthcare team?
Yeah, I think definitely the healthcare team is the best thing to do. I would start with your doctor. A pharmacist can be helpful too. The tricky part right now is that within healthcare, whether it's a physician, nurse, pharmacist, many healthcare providers are not taught about medical marijuana. So that's why I think it's probably best to start with your physician, because they know your entire health history, and pharmacists may not always know that. They can provide some great information, but starting with your doctor first is probably the best way to go about it.
Thank you. This person is asking on behalf of their spouse, how do you feel about vaping flower and carcinogens? They have a vaporizer and uses flower, not oil. Mm-hmm. Is there any concern there?
My understanding is that the oil is better in terms of the possibility of the combustion causing carcinogenic substances to be inhaled. So it would be preferred to use the oils. But I would also just talk with your dispensary folks, because they may have an understanding of the type of vaporizing machine that you have, and maybe there's a possibility that that eliminates some of the carcinogens. There are different products available.
Thank you. Have you had any barriers or issues with securing research funding in this area because of current policies and the Schedule I classification?
Yes, until recently, until many states had medical marijuana regulation passed, I think there's been very little research that has been available because of what that was just said, because it's a Schedule I drug. I know within the state of Connecticut and other states, because of their rescheduling of the drug to a Schedule II, they're allowing more research within the state itself, but federal funding is still very difficult to obtain.
And it's my understanding that the to access medical cannabis for research, there's only one dispensary in the country. Is that true? And where is that? That's
true, and it's in I forget which southern state, and I apologize, I'm blanking on it right now. I believe it might be Mississippi or Alabama, and I can't remember which one it is. I apologize.
Okay, no problem. Let's see, when is the FDA expected to approve, is it Cannabis in the US for cancer?
Yeah, it's come up to the FDA for evaluation a couple of times, and the last time I looked, it was still under review, so I'm not sure when the expected date is, or what the issue has been with why it wasn't approved the first time.
Is there any thought in terms of, seeking a prescription, I suppose, for medical marijuana before the onset of cancer treatment begins, as someone might to manage side effects before they start?
Yep. So if the cancer treatment is known to cause some side effects that could be mitigated or helped by medical marijuana, then some providers may be willing to do that. For example, in our own patients, if a patient has cancer, so they have active cancer, then we will allow them to get a certification right away. So it's not technically a prescription, but it's called certification. And that would be okay. But I think providers have a different level of comfort in certifying patients, so it might depend on your physician.
Thank you.
And it certainly does. I mean, the benefit of doing it up front is that you have the process already in place. You're already certified and have an application all the way before you develop any symptoms, so that you could go and then purchase product when you're having symptoms, and there wouldn't be a delay.
Okay, so this one's specific to, I guess, side effects. So can you discuss how medical marijuana might help side effects such as GI symptoms caused by your cancer treatment, like diarrhea, stomach pain, etc.?
So I work a lot with colon cancer patients, actually, and rectal cancer patients. So or patients who might have cancers in their gastric or esophageal area. So a lot of disease-related symptoms as well as cancer treatment-related symptoms. It seems to work well for patients who have that. So we're very good at preventing vomiting associated with chemotherapy, but not so great at preventing sort of low levels of nausea or abdominal discomfort. And so it can be very helpful in those patients. I haven't seen it helpful for treating diarrhea, but most of our patients are able to be well controlled with some other drugs like Imodium or loperamide or Lomotil. It does help with abdominal pain and can also just help with pain in general so that people can have better sleep or more sort of comfort throughout the day.
Thank you. And another question specific to CBD oil, you had mentioned that because it's not regulated by the FDA, there is potential for contamination or other ingredients to be included. Where would someone go to find, like, how do you know if the product that you're purchasing is actually what it says it is? Is there any way to do that?
That's a very good question, and unfortunately there is no way to actually do that. So there's been studies that have been done with things like even with vitamins. I don't know if you recall a couple of years ago in the state of New York, the Target brand of vitamins and supplements were found to contain ingredients that were unrelated to what was labeled on the container. So even supplements like that can have this problem, and there is no resource to go to, unfortunately. For those people who, so I always recommend for patients, regardless of whether it's CBD oil or some other supplement, that you just are aware of this and that you have a list of these things that you're taking so that if we see any untoward side effects, we can, maybe critically think about whether it could possibly be the supplement or not, and then we would make a recommendation of what to do. But unfortunately, there isn't a resource.
Okay. Well, it looks like that's all that we have for questions. We flew through those. Thank you so much, Dr. Holt, for a great presentation, and thank you everyone for tuning in. As I mentioned earlier in the session, this has been recorded, and we will upload it to the Fright CRC website later today, and you'll receive an email tomorrow around this time with a direct link. If you want to watch before then, you can just search for it on the website. And thank you again, Dr. Holt, for your time and for sharing your expertise.
Thank you for the invitation.
Have a great day, everyone.